Good afternoon. Our lecture would be on public health, what it is, and why you should care. So, for clinical medicine, our focus would be rely heavily on diagnosing symptoms, enhancing the capacity to function, treating and preventing diseases, relieving pain, and providing comfort. The public health perspective implements and evaluates populations based strategies to promote health and prevent disease, develops and enforces public health laws, assessing and monitoring health problems, assessing the provision of essential health services. So, by definition, public health is the science and art of preventing disease, prolonging life, and promoting health and efficiency through organized community efforts. This involves sanitation of the environment, control of community infections, education of the individual, organizing medical and nursing services for the early diagnosis and preventive treatment of disease, and development of the social machinery which will ensure to everyone a standard living adequate for the maintenance of health. So, organizing for these benefits as to enable every citizen to realize his birthright of health and longevity. So, by definition, it's an organized community effort aimed at the prevention of disease and promotion of health and links many disciplines and rests upon the scientific core of epidemiology. Framework of public health encompasses both activities undertaken within the formal structure of government and the associated efforts of private and voluntary organizations and individuals. The mission of which would be the fulfillment of society's interest in assuring the conditions in which people can be healthy. So these would be the fundamental obligation of the agencies responsible for population-based health. These would be to prevent epidemics and the spread of disease, protect against environmental hazards, and prevent injuries, to promote and encourage healthy behaviors and mental health, respond to disasters and assist communities in recovery, assure the quality and accessibility of health services, such that its vision would be to have healthy people in healthy communities, to promote physical and mental health and prevent disease, injury, and disability. So, there's nothing new. So, in Greek gods, there's panacea and hygeia of healing and health, and Hippocrates urged physicians to pay attention to the environment, social, and behavioral context in which illness occurs. So, when a committee of the Massachusetts legislature confidently asserted that all governments since the time of Moses had made provision to protect the life and health of their people, the legislators affirmed a tradition of corporate responsibility for the welfare of their people. And I'm pretty sure if you look at Indian culture and Indian history, you will see that your forefathers have mentioned that health and environment are all interlinked with each other in the community. So historical relationship would be an early supportive relationship prior to the early 20th century. So this is a period of professionalization and practice transformation spurred by the emergence of bacteriology, an acceleration of functional separation in the post-World War II era, the brave new world of managed care and cost emphasis, and the new understanding of public health in a post 9/11 2001 world. So why should you care about public health? As physicians, it's our duty and obligation to report certain conditions and cooperate with the authorities. We help get individual patients services they need. and help improve the legal, financial, and social environment that you work in. So medicine and public health works synergistically. So they both improve healthcare by coordinating services for individuals, improve access to care by providing frameworks to provide care for the uninsured, improves the quality and cost effectiveness of care by applying a population perspective. They use clinical practice to identify and address community health problems, strengthen health promotion and health protection by mobilizing community campaigns, shapes the future direction of the health system by collaborating around policy, training, and research. So, not all powers are delegated to the United States or the federal government, and more often it's reserved directly to the states or to the people. So, this police power, so this is the sovereign power of the states to provide for health, safety, and welfare. These are usually delegated to local governments or to the federal government, albeit indirectly. Federal government indirectly because your federal government will be in charge of commerce, funding, national security, and the like. State government takes the primary responsibility as well as your local government. So, for example, in Pennsylvania, a communicable disease declared reportable by regulation or any unusual or group expression of illness, which, in the opinion of the Secretary, may be a public health emergency, is covered under Chapter 3 of the Consolidated Statutes. So, how does it work? So, core functions would be assessment to develop policy and assurance. So, these are the 10 essential services of public health. So assessment function is the collection to assemble, analyze, and distribute information on the community's health. So for assessment, monitoring health status to identify community health problems, to diagnose and investigate health problems and health hazards in the community, evaluate effectiveness, accessibility, and quality of personal and population-based health services. Policy development involves the development of comprehensive policies based upon scientific knowledge and decision making. So, examples of which would be to inform, educate, and empower people about health issues, mobilize community partnerships to identify and solve health problems, develop policies and plans that support individual and community health efforts. And assurance. So the committee recommended that a set of personal and community-wide services be determined by involving key policymakers and the general public. Once identified, the committee recommended that these services be provided to all members of the community either through encouraging actions by others, by requiring action by others, or by direct provision. Assurance also involves assuring a competent public health and personal health care workforce, enforcing laws and regulations that protect health and ensure safety, link people to needed personal health services, and assure the provision of health care when otherwise unavailable. We also look at impacts assessment, policy, and assurance. We research for new insights and innovative solutions to health problems. And these are some examples. So, monitoring health status to identify community health problems. Examples would be the death and birth certificates, immunization registries, and surveillance. So, diagnose and investigate health problems and health hazards in the community. Examples would be outbreak investigations, child death and review boards. Informing, educating, and empowering people to identify problems. Develop policies and plans that support individual and community health efforts. Smoking bans, helmet laws, lockdown laws for the recent coronavirus. Enforcing these policies and regulations that protect health and ensure safety, such as your food inspection certificates, enforcement of your smoking regulations, enforcement of your lockdown bans, and the like. Linking people to needed personal health services and assure the provision of health care when otherwise unavailable. So these are your insurance programs or your centers. This is to assure a competent public health and personal health care workforce. So, continued medical education, such as conferences, training programs, journals, schools of public health, certifications, etc., could be done. Evaluation, of course, is important to evaluate effectiveness, accessibility, and quality of personal and population-based health services. Of course, research for new insights and new solutions to health problems, such as the development of your coronavirus vaccine. So, for example, for heart disease, we aim to monitor health status to identify community health problems, diagnose and investigate health problems and health hazards in the community, inform, educate, and empower people about health issues, mobilize community partnerships to identify and solve health problems, develop policies and plans that support individual and community health efforts, assure a competent public health and personal health care workforce, enforce laws and regulations that protect health and ensure safety, link people to needed personal health services, and assure the provision of health care when otherwise unavailable. Evaluate effectiveness, accessibility, and quality of personal and population based health services, and research for new insights and innovative solutions to health problems. So I leave you with this exercise. Think about the current public health problem faced by you or your institution, and take that public health problem or issue and think about how the 10 essential services of public health can solve that problem. I leave you with this. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has. Thank you for listening to this preventive medicine lecture. Please do follow and subscribe our PMCH channel, Audrey Angeli Andres MD, for more lectures on preventive medicine and community health. Thank you.